Hi, I'm Peter Kamenický and I'm endocrinologist, and I would like to present you the case of this patient that came to see me in February 2016 for short stature and impuberism. And you can see on this picture his physical appearance that was that of a young boy despite of his age of 34 years. And this is because of a complete lack of anterior pituitary hormones, congenital hypopituitarism that was naive to treatment, and the complete lack of gonadal and adrenal sexual steroids led to preservation of gross cartilages, as you can see from the X-ray of the hand and MRI of his knee. He had to return to his country and came back 3 years later, when we started in 2019 stepwise hormonal replacement therapy, and you can see details on this treatment strategy in the appendix that led to an increase in his height of 24 centimeters and also to typical pubertal changes, as you can see from his face, but also to normal genital development. We wondered whether the heart would also grow normally and assist heart structure and function by repeated cardiac MRI. And you can see that at baseline he had a small heart that was well proportionated to his body size and had preserved contractile function. And then the heart grew linearly, and you can see here the left ventricular mass indexed to the body surface area that increased, and in parallel a decrease in extracellular space, suggesting that the heart growth resulted mainly from correction of cardiomyocyte hypertrophy. And here in the right panel you can see the changes in the left ventricular stroke volume that were parallel to the increase in left ventricular and diastolic volume, reflecting the capacity of the left ventricle to enhance his contractile force in response to the increased venous return when the body was growing. And this is the so-called called Frank-Starling law or Frank-Starling relation. And thank you very much for your attention.